I've been mostly in the field. I worked from home one day last week, and I worked from home today, which is undecided because I may end up having to go out later. It's overwhelming. It's overwhelming. It's caused a lot of anxiety. And as far as my safety goes, it's just, I do my best to take precautions. Yes, I worry that I'll bring it home. Also, my husband is an essential worker, so we're both out of the house every day. But my worry is more for the clients, I think, because ultimately I'm in fairly good health. I'm young. I can fight it if I get it, hopefully. But I have a lot of clients that can't.
Can you just describe the population that you're normally working with?
Yes, I work with the population of severe mental illness, and some of our clients also have the dual diagnosis of substance use disorder. Mm-hmm. So about half, I would say half of my client load of 13 are also substance use, so dual diagnosis. But some of the severe mental illnesses, we work with major depressive disorder, we work with schizophrenia, we work with schizoaffective disorder, bipolar 1, bipolar 2, and those are the main ones. We're doing, essential tasks, but there's a lot that's essential, especially now with all the partial care programs being closed. It's a lot of organizing people's injections and just making sure everybody has their meds, everybody's scheduled for their teleconferences. There's just so many things that we don't usually have to do that now we're having to pick up because partial care programs are closed.
Right.
So they're open for like injections. So they're open one day every week for injections. Oh. And they have staff there that you can communicate with. But other than that, like everyone's home, thrown everyone off of their routine.
Can you just describe what a partial care program is?
Yes. Partial care program is where most of my clients go at least 3 to 5 days a week. They go there for groups. They see their psychiatrist there. A lot of them get their medication delivered to the partial care program and they go home with it. It's a therapeutic place that they go. All the groups are therapeutic. They are for, self-esteem, for drug abuse, for just managing symptoms, coping with depression, coping with grief. And all of that is lost now. So it's a place where they go to feel like they have something filling their day to day. We go to work and that occupies us. That keeps us, motivated. That keeps us going. And partial care program is kind of like that for them. Some of them have jobs there. Sometimes they hire within and they allow them to do secretarial work or, cooking and things like that. And now it's just, they don't have any routine that's keeping them motivated throughout the week.
Is there any other way that's been changed for your job?
We've limited transportation as much as we can. So, for example, I had someone who needed to just go to the pharmacy, and it was something that I could have done independently. So I offered to do it independently without the client. So we're doing a lot of kind of errands to try to limit our clients' exposure in the community, but then we're exposed in the community. So it's definitely a balance of trying to protect them while also trying to protect ourselves.
Why is it important for you to provide these kinds of services?
So what we do is basically we coordinate all of these areas of this person's life when we meet with them once to twice a week. So, for example, we do medical appointments with them, organizing, taking, following up. We do medication, making sure that they're trying to make sure they're taking it because, again, we're not there every day, but just reviewing their medications with them, educating them about the benefits of maintaining their medication. We do a lot of mental health interventions, which is sometimes just kind of teaching them coping skills and ways to deal with things like anxiety, stress, these crisis things that pop up that we so easily deal with on a day-to-day, but for them it's so difficult when something does not go as planned. So it's us stepping in and kind of brainstorming with them and trying to problem solve and We maintain their housing. They have subsidies with us that we are the provider agency for, so we have to make sure that their subsidy renewals are due. When they're due, they're completed. We have to make sure all the information is gathered and submitted so that they can continue to receive this subsidy on an annual basis and continue to sign this lease with the landlord. I have 2 clients that unfortunately, if I don't go out and meet with them at the first of the month, they will not pay their rent. Right. So it's just like, it's maintaining every area of their life on a weekly basis. Right. So it's not doing for them, it's doing with them. So that's the part that's so hard now. We're not really used to having to take on such a hands-on role, because a lot of what we do is teaching and educating and modeling skills so that they can be able to do it independently. So it's a little bit hard when you're not there face to face being able to teach those things.
What would happen if those services aren't provided? Can you give me a kind of, if there is a typical example of what would happen if these services aren't provided?
So for example, yesterday I helped people pay rent. 2 people that I see every month to pay rent. Had I not gone out and done that, they would not have paid themselves and they could be going into eviction. For 2 people, I've been organizing their biweekly and their monthly injections. Without those, they don't have their psychiatric medications and they will become symptomatic, which usually leads to a hospitalization. So a lot of the things that if we're not doing could lead to either hospitalization or evictions. And even physical health, like, we have clients who are diabetics, who are, who have kidney disease and things like that. So if somebody isn't there reminding them, hey, is it time for you to, renew your medication, or is it time for you to have a follow-up visit with these specialists that are maintaining these things, they may not do it. And if they don't, that could be a life-threatening thing. Right. Also with the substance use right now, that is huge. This pandemic is a huge trigger for substance users. It is highly stressful and overwhelming for us. I can't imagine someone who is also trying to maintain their sobriety, during this time. A lot of people are looking for that calming effect, and some people find that in drugs. And so it's just kind of maintaining that reminder of, okay, these services are here for you, this support is here for you. You have a relapse prevention plan. Let's try to put that in place before, you end up doing something that could harm you. It feels in essence like we have to put aside whatever our needs are, because there are needs greater than ours. And it's hard to say that, but we are a little bit more equipped to handle certain emotions and certain feelings and certain anxieties than a lot of people that deal with severe mental illnesses. It's, for us, something that happens may be really difficult to deal with, but for them, it might be the end of the world. And we need to step in and try to support them whatever way we can. So a lot of the times we have to shove our own anxiety. I mean, I had a client yesterday, one of the clients I saw yesterday to pay the rent was, he's typically very difficult to deal with, just because he has very high highs and very low lows. And a lot of the times they occur simultaneously in the same meeting. So it's very difficult to manage and to get things done. So things like going to the post office and getting a money order to do his rent is like, it becomes this huge thing. So I was like, listen, I'm going to sit right here in this car, in this parking lot of this post office until you decide what you want to do. So for 20 minutes, he just ranted in my back seat and then eventually went in and paid his rent. But I had to deep breathe while he was ranting in my back seat.
Yeah. And, so if you didn't, that rent probably wouldn't have gotten paid, right?
Exactly, because he was about to walk off. So I got in the car, but he stayed out and he was about to walk home. And I guess something pulled him back, because I wasn't engaging with him. And sometimes I think that that's what he wants, but I wasn't. I was just like, you know what? I'm gonna go in the car and I'll be there. I'm not moving, but I'll be in the car. So he was about to walk off, and then he comes back and he gets into my back seat, and that's when he starts his 20-minute rant. And I was just like, you know what? I'll let him rant. We're not going to move from here. We'll see what happens. And eventually he was like, all right, I'm going to do it. I want to do right by Easterseals. Easterseals has helped me. So his whole attitude changed. He was so grateful, so happy that he has housing, where in the beginning he was telling me that he wanted to go and move to Atlanta because New Jersey was too expensive.
Yeah.
So it was an experience.
All right, well, fantastic. Thank you so much, Crystal.
Thank you, Bert. I can't wait to see what you come up with.